Hello and welcome to this session on academic publishing in the post-COVID world. I'm Roger Watson and I am the Professor of Nursing at the University of Hull in the United Kingdom. I'm also currently the Editor-in-Chief of Nurse Education in Practice. Until last year I was the Editor-in-Chief of the Journal of Advanced Nursing, and prior to that I edited the Journal of Clinical Nursing. First, I want to outline what this presentation is about. The contents of this presentation will be divided up as follows. First, I will give a journal update. Then I will talk about some recent developments in academic publishing. And finally, I will talk about COVID-19 and its impact on academic publishing. The journal update will be about my own journal, Nurse Education in Practice, and it will be very brief. The recent developments will include open access, open science, and pre-printing. This is my current journal, Nurse Education in Practice, and the most interesting thing that's happened is this year, since I took over the journal, the impact factor has doubled up to 2.281, and we are now number 38 in a league table of 123 journals. The impact factor has not increased because of anything I have done. I haven't been at the journal long enough. My influence, if any, will be seen in future years. This slide shows the submitted articles both by country and by region. And you can see in the top part of the slide that the dark blue area is Asia. That includes mainland China. And by far the biggest single country in Asia submitting to my journal is mainland China. So you are a very important market, both for manuscripts and for readership. And the interesting thing to look at, if you look at 2017, 2018, 2019 and 2020, not only are the total number of articles being submitted increasing, but the number of articles from China is increasing greatly. And I have to say, although we'll come to the COVID-19 pandemic later, that the increase in articles from China has been largely related to COVID-19. However, this slide shows that China is by far not the largest country publishing in the journal. This is represented by the light grey area, which represents Europe, and that is largely represented by the United Kingdom. So I would like to see a higher proportion of the articles that come from China being accepted in the journal. And so we move on to some recent developments, the first of which is open access. Open access is becoming increasingly important. There are essentially three models of open access which are shown on the right, and open access articles are free to read and free to download, and there are different models by which articles become open access. This is in contrast to the model on the left, which is the subscription-based model, and as you can see that's got a brick wall or a firewall around it, and that means that you have to pay to subscribe and pay to view those articles. You do not normally have to pay to publish under that model. So on the right hand side, starting at the top, we have a platinum model of open access, and the platinum model of open access allows immediate open access to articles, and it says there without an APC, without an article processing charge. So you do not have to pay to publish under Platinum Open Access, and you don't have to pay to view it. However, as you can imagine, there are very few Platinum Open Access journals, and I do work with one, which is the Wiki Journal of Medicine, and that's available on a platform that is like Wikipedia. Unfortunately, that isn't available in China because you're unable to access Wikipedia. By far the most common model of open access is the Gold model of open access. This allows immediate access to the article, free online. However, an APC or an article processing charge has to be paid by the author, and these can be quite large. Finally, at the bottom, there is a green open access model, and this is a model that's used by many universities whereby they make their publications available free to access, however, usually after a period of 6 to 12 months after the article has been published elsewhere. So it doesn't offer immediate access, but it is free to access, and it is free for the academic to make their article available by green open access. I'm mentioning open access because it's becoming very, very important internationally. In Australia and the United Kingdom and in Hong Kong, for example, researchers are obliged to make their articles available open access if they've been publicly funded. I know that open access is increasing in mainland China too. So open access is something that you will definitely encounter in the future when you are publishing academic articles. But how can you decide in which open access journal to publish? There are a great many. The considerations include the following: cost, sustainability of the journal, and the reputation of the journal. The cost, as I say, can be quite high, sometimes around $3,000, although journals like Nature are charging a great deal more. And some of these journals are moving increasingly towards being open access. I mention sustainability, and I refer here to whether or not the websites on which open access articles appear are likely to be there in the long term. So I would always advise you to publish with reputable, well-funded publishers, such as Elsevier, Wiley, the BMC journals, and so forth, ones that you know about. And also the reputation. The reputation generally of open access is just developing. Some people remain very suspicious about it. And of course, there are many predatory journals acting in this area, and I will talk about them soon. If you're concerned about an open access journal, or you want to find a suitable open access journal, one of the best places to look is the Directory of Open Access Journals, the DOAJ. And the DOAJ contains journals which have been verified. They've got an international editorial board, they've been in existence for at least a year, and they adhere to ethical practices. So for example, until recently, when I edited the Journal of Advanced Nursing, I also edited Nursing Open for Wiley, and Nursing Open was a completely open access journal. And just to show you that in the middle of the screen there, Nursing Open appears on the Directory of Open Access Journals, and it has a green tick next to it, which means it's been verified. And you can find out other information about the journal there, such as when it was added what the subject material is, what the peer review system is, and what the APC is on the right-hand side. For that journal, it was $1,650 US. Another excellent place to check, because there are very few open access journals yet on the main Clarivate site. Nursing Open happens to be one of those, and it was amongst the first to be included. You can also check the Emerging Sources Citation Index. These are journals that have been approved for the impact factor list but have not yet been included, but they are verified journals, and a great many of these are open access. So you can check here. Of course, you can also check Medline, PubMed, and other reputable databases if you have access to these through your university. But what about predatory journals? By predatory journals, I mean journals which publish open access, charge very little for you to publish with them, but which are not reputable. They do not put articles through peer review. They are not what they claim to be, and they often claim to have editors and editorial boards who either do not know that they're part of the journal or do not exist. You have to be very aware of predatory journals and avoid them. This graph is slightly out of date, but it shows the trend in the increase in predatory journals. The number of predatory publishers is shown in red, and these have increased. The number of predatory journals likewise has increased. And down at the bottom right in blue, you will see that there's another trend called hijacked journals. And these are journal web pages which are taken over by hijackers, by predatory publishers, or ones which are created which look exactly like the parent website, but they're false. And you will always know that they're false because you should never pay money to submit an article. You only pay money to make it open access. So you should only pay money once the article has been accepted. Do not pay money at the beginning. If a website is asking you to pay money, it will be predatory. Now in 2016, it was reckoned there were around 1,000 predatory publishers and around 900 predatory journals. It is reckoned now that there could be anything between 10 to 100,000. This has grown incredibly. And once you publish, and I know that Chinese colleagues have already received these, you will receive emails asking you to publish with these journals. Never respond to them, just delete them. However, what if you're worried about this? And I would advise you not to be worried. It's quite easy to avoid predatory publishers. And what we advise is for you to use the think, check, and submit rules. Think before you submit. If you have any doubts about a journal, check the web page to find out if it exists and does it say clearly who it is and are the claims it makes verifiable. If you've checked and you are happy that the journal is okay, that it's not predatory, then you are free to submit. But always think, check, and submit prior to publication to any journal that you are concerned about. And here's a very helpful predatory publishing quick check list of points. Ask yourself, in fact, check online, has the publisher started dozens of new open access titles all at once? That sometimes is an indication that it's predatory. Do the published titles, the journals, do they have very few papers, if any? If they don't have any articles, then they are predatory. Some predatory publishers will take your money and not publish your article. Does the publisher send emails asking for manuscript submissions or to serve on the editorial board? Always, as I've said already, be very careful about these. Does the publisher fail to disclose the names and qualifications of editorial board members or editors? That's definitely not acceptable, and if it does, then you can check them, and sometimes you can check with the people to make sure that they are genuine members of that board. Is the publisher's address not verifiable? The publishers rarely use correct addresses. The publishers are often based in South Asia, yet they claim to have addresses in the United States, often in Washington, D.C., but these are not real addresses. And then, is there very little evidence of peer review? Any journal that offers you quick publication or rapid peer review cannot be genuine, because as all editors and as any experienced author will tell you, peer review is a slow process and it shouldn't be and cannot be speeded up. It's very difficult to do. The only way to speed up that process is to avoid it, and therefore many of the articles that are published in predatory journals have not been reviewed at all. Back to open access and the advantages and disadvantages. The advantages include speed of publication, increased citations for which there is some evidence, and of course it's much easier to share your findings and your publications. The disadvantages are the cost. For gold open access, this can be prohibitory. It can be very high. I don't advocate that individuals should ever pay these costs themselves. I think you should always try to get your institution to pay or to have your research grants costed for having open access publications. One of the major disadvantages of open access is that it's given rise to predatory journals, which I've already spoken about. And frankly, the reputation of open access, while it is much better now than it used to be, despite many countries insisting on open access, the reputation is still developing. The next recent development I want to talk about is open science. Now, open science is something that has originated in Europe, and it covers many things, including open access. But like open access, open science is spreading internationally, and major publishers like Elsevier and Wiley, who publish a great many of the journals that we publish in, are fully signed up and support open science. So you need to know about open science and the different aspects of open science. So, open science is the movement to make scientific research, and that includes publications, data, physical samples and software, and its dissemination accessible to all levels of an inquiring society, amateur or professional. So that means that it's available to fellow scientists, but also to the general public. Open science is transparent and accessible knowledge that is shared and developed through collaborative networks. In other words, the way that open science works often means, for example, that articles are made available online early and can be commented upon and improved as preprints, which I'll come to next. Data are shared and databases are added to and can be used by anyone. So it encompasses practice such as publishing open research and campaigning for open access, which we've talked about already, and also encouraging scientists to practice open notebook science. That means keeping a meticulous note of every stage of your research, which is what we should always do anyway, but also to make that available to other people. And generally it makes it easier to publish and communicate scientific knowledge. That's the idea behind open science. So the main things about open science that are relevant to us are open access publishing, data sharing, and preprinting, which I will come to next. There are some platforms such as the Open Science Framework where you can publish your research in an open way. In other words, you can register your study in advance, you can add data to the site, and then you can add links to the final published article and to any preprints. This has already been working for quite a long time in clinical trials. As you probably know, all clinical trials should be registered in advance, and the results and the data and links to the published articles should be supplied there. Open science is, in a way, an extension of that. And another very similar site is the Centre for Open Science. As far as I know, the Centre for Open Science requires a fee. The previous slide that I showed you, the Open Science Framework, is free to use. And I know that because I've already used it myself. The next recent development, and very much related to open access and to open science, is preprinting. And preprinting is not new in, for example, the biological sciences. It's quite new in medicine, but I think it's very new to nursing. And just to make sure that you understand that all the major publishers accept preprinting, you have to check with some individual journals whether or not they accept preprinting, but all the major publishers are signed up to it. There are one or two anomalies for society journals, but these anomalies are being fixed. What I've shown you in the picture there, it says RXIV, that's Med Archive. That's a open access preprinting site run by Yale University, the Cold Spring Harbor, and also by the British Medical Journal. And it has a specific nursing section in it, so I would strongly advise you, if you're going to publish open access, to use Med Archive. I've used it myself already, and it's very easy to use. But what is a preprint? Well, this slide is supposed to show the relationship between a preprint and the published article. So in the top, in grey or silver, is the preprint. This is essentially work. It can be in progress, but it's usually an article that is published on a preprinting site before the article has been sent to a journal for peer review. So it's made very clear that the preprint is not peer reviewed. The purpose behind preprinting is two things. One, so that you can possibly get comments on your article from colleagues and from any reader, and these can be quite helpful, but it also allows you to share your data early on the understanding that it hasn't been peer reviewed. Then it's related to the next stage. Once an article is accepted, you may make it accessible on a green open access repository as a post-print. Of course, there will be some embargo period of 6 to 12 months before people can use it. And finally, there will be the fully published version, which may be published gold open access or may simply be published under the traditional model, but will be available either by subscription or will be available because it's open access. Under open science, it's strongly encouraged that everything is published at some level of being open access. So the preprint is the first stage in that process, and it's increasingly becoming important and indeed encouraged to publish preprints. So a preprint, here's the explanation. A preprint in academic publishing is a version of a scholarly or a scientific paper that precedes formal peer review and publication in a peer-reviewed scholarly or scientific journal. The preprint may be available often as a non-typeset version, available free before and or after a paper is published in a journal. So that's all that a preprint is. So finally in the presentation I want to talk about the implications of COVID-19 for academic publishing. So I want to share with you now some observations that I've made and have been made by my fellow academic editors in nursing following the COVID-19 pandemic. First of all, there's been a global pandemic of articles on COVID-19. Within weeks of the pandemic in China, articles were beginning to arrive at academic journals, and they continue to arrive. I will talk about the issues and the problems with that very soon. But not just from China. Other areas of the world, other parts of the Far East, Southeast Asia, and in Turkey, and in Iran, and even in Europe, there's been a great many articles submitted on COVID-19. But the majority have come from China because you were the first to suffer from the pandemic, and there are more of you in nursing here than in most parts of the world. China's a vast country, so we would expect to see articles coming from China. But it has been described by colleagues as another pandemic. Unfortunately, most, and in fact I would say the vast majority of these, have been of a very poor quality. And I'm sorry to say that when I see an article submitted to my journal, and it was exactly the same in my previous two journals, Nursing Open and Journal of Advanced Nursing, if I see an article with COVID-19 in the title, I'm immediately alerted to the fact it probably isn't very good. Now, some of them are very good, and some of them go forward for review, and then some of them are published. However, again, the vast majority of these are poor quality and simply get rejected. I will talk in a couple of slides' time as to why this is the case and how you can improve your submissions on COVID-19. It's noticeable that a great many of the articles on COVID-19 that have been published have been retracted. That means they've been found to have mistakes or flaws in them and have been taken off or indicated as retracted papers. Now, that doesn't apply so much to nursing, that's mainly in medicine, but it probably will apply to some articles in nursing too. So it indicates that these articles are of a particularly low quality. Many simply remain as preprints, and that's the same for nursing and many other subjects. And many never get beyond the preprint stage. They go up as preprints, they are sent to journals from which they are rejected, and then they're sent to more journals from which they are then rejected, and they never actually seem to get published. So another indication of the low quality of a great many of the COVID-19 articles that have been submitted to academic journals generally, including nursing journals. Now, what I want to outline here are the problems with many of the COVID-19 articles from China. Now, some of these problems are not just in Chinese articles, they're common to other areas of the world, but I wanted to help you with particular observations that I've made about articles from China. Most of the articles are simply local reports. They say something like, this is what we did in our hospital, and that really isn't of great interest to anyone because it's not generalizable. It's not necessarily very different from what anyone else did. It's not really research, it's reporting, and these articles are of very little interest. And I know a great many of my fellow editors have complained about this kind of article coming in. So it does seem that people have been rushing to get published on the back of COVID-19, not taking their time and essentially wanting to advertise what their hospitals were doing rather than making a genuine contribution to knowledge. There's also been the use of emotive and combative language, and this is no use in academic publishing. You have to take emotions out of it completely and report as objectively as possible. But there's been a great deal of subjective and even propaganda type writing in academic manuscripts. So by emotive articles, I mean articles talking about the suffering of nurses and essentially feeling sorry for yourselves, talking of the white army of nurses, talking about fighting the pandemic, the war against the pandemic, this sort of language. Absolutely no use at all for academic writing. So try to avoid this. Try to avoid using emotions to try and sell COVID-19 articles. There's been far too much of it, and I will be absolutely honest, nobody is interested. They have to be genuine academic articles which will make a contribution to the field of knowledge. Emotive and combative language is okay for newspaper articles and social media, but keep it out of academic publishing. I've already mentioned this, but just absolutely nothing new or unexpected is being reported. For example, we could have predicted that nurses would be stressed by COVID-19. We could have predicted that patients would be feeling fearful and afraid under COVID-19. We know these things. They're not unexpected. They're the same for any pandemic and most illnesses. There's nothing particularly special about COVID-19 except with the speed and the extent of the world to which it's spread. So we're not really interested in hearing things that we already know or would have expected. There's been very little about how the fear amongst patients or the stress amongst nurses has been tackled. That would be more interesting, but they've just been reporting nurses are stressed, patients are afraid. No interest and not really adding much to the general database. And in the same way, these have been purely descriptive studies without inference, just giving numbers rather than attaching those numbers to, for example, gender or level of qualification or to different professions. However, there have been some articles with inference and they've generally been very good, but on the whole, articles are purely descriptive. So you can see a pattern developing here. And also they contain uncritical statements about government policy and even glowing statements about government policy and the things that the Chinese government has done or other governments in other countries have done. Again, this is not suitable for academic publishing. On the whole, these articles have been written prematurely. We began to get very worried as editors when articles were coming out within weeks, even 2 months of the pandemic. There was absolutely no time to do rigorous research and absolutely no time, for example, to get ethical clearance for our studies. So we were very concerned that these studies were very poor and possibly unethical, but very poor and done prematurely. So people were not willing to wait. I think we need to take our time to do research, even in a global pandemic. And of course, no international perspective. So telling us about how a hospital in China copes with a pandemic is of little use to a hospital in the United Kingdom, for example, because our health systems are completely different and our hospitals are completely different. So again, lacking an international perspective was often a problem. However, I think there are lessons to be learned. I think there are ways in which we can improve publishing in pandemics in the future and in the COVID-19 pandemic, which may well continue for some time. We've got to learn that a global pandemic is not a license to publish poor articles. So as editors, we don't make any compromises here. Newspapers will publish articles because they want to look for sensational articles or something that's new and emerging, but academic publishers and editors do not and should not respond to that. So because there's a global pandemic and a great deal of fear and indeed a great deal to be learned, it isn't an excuse to publish poor articles. Because of the speed with which COVID-19 spread and the pandemic spread, we weren't prepared for it as publishers and editors. So we do need to be prepared with policies and strategies for the next pandemic, wherever it arises, because there will be one. It may be next year, it may be 5 years, it may be 20 years, but there will be another one. And I think we need to be prepared for that as editors and publishers to make sure that we're ready for it and to make sure that we know how to publish the best quality articles. And we've got to be aware as editors, and you have to be aware as authors, that poor articles generally give editors a poor impression of all the related articles that are submitted and other research in that field. What I mean here is that we immediately associate COVID-19 with poor articles. That's exactly what editors are tending to do at the moment. It isn't always true, but we do have to realize that we have a responsibility, and as authors, you have a responsibility not to create a poor impression. So as researchers, and I'm one of those too, as well as an editor, we should begin to prioritize the kind of studies that are needed the next time there's a pandemic. Now, I'm not an expert on pandemics and epidemiology, so I can't really say what this should be, but I also think that researchers need to be ready for the next pandemic. How are they going to create minimum data sets that are useful? How are they going to combine data sets from different hospitals to create bigger studies that are more generalizable and of wider interest? And how are they going to collect data and analyze it and publish it in a way that's genuinely helpful and not just descriptive? So I think there's an agenda for researchers, and particularly for nursing researchers, to get together and think how they're going to prioritize research if there's a pandemic next time, and there will be another one. And I think that perhaps we need a global strategy for research and publishing by nurses during and after pandemics. I think we need to be clear what we're doing next time. For example, not accepting articles within, say, 6 months of the beginning of a pandemic, or I'm just suggesting that, but we need to have a period within which it would be reasonable to do reasonable research. And I think we need to set down clear standards for the kind of articles that we will publish. And this is purely because we have been completely inundated. Many journals have been almost unable to cope with the number of articles coming in during the pandemic, and we simply cannot have that again. And I think, because of your own experience in China, that you should be leading that here. I think you've got the most experience, and I think you should be taking responsibility for that. So I would like to see Chinese nursing researchers and clinicians getting together and telling us what the strategy should be, not us telling you. So thank you very much for listening. This is my email address if you're interested in commenting or in contacting me. If you want to check out my own research, you can look at my ORCID number. You won't be able to follow me on Twitter in China, but you will be able to keep in contact with me by WeChat, so you can scan the QR code there if you want to, and you're welcome to keep in touch with me, keep in contact with me, ask any questions. Once again, thank you very much for inviting me to give this presentation. I hope it was useful. Goodbye.